The health department is estimating that 90% of the target population in Metro Manila could be vaccinated by the end of the year. To discuss this, we have Greg Gregorio now joining us live from Mandaluyong. Good morning, Greg. So could you tell us whether LGUs can start vaccinating members of the general population already?
Good morning, Charles. According to Health Undersecretary Maria Rosario Vergere, LGUs can now start vaccinating the general adult population. It is up to LGUs, though, if they would want this rollout be via walk-ins or otherwise. But the DOH is reminding LGUs to keep or to maintain dedicated lanes for senior citizens and people with comorbidities, as these sectors are still the ones that are most at risk for contracting and suffering from the disease, and they're still the ones being prioritized for the vaccine rollout. Charles?
Right, Greg, what about pediatric vaccinations? Will the initial rollout push through on Friday? And if so, do we know which vaccine brands will be used?
Yes, Charles, according to Undersecretary Vergere, the pediatric vaccination on Friday, October 15, will push through, as there are already 8 hospitals being identified as venues for the initial rollout of these pediatric vaccination for ages 12 to 17 with comorbidities. Vergere said we will be using Pfizer and Moderna vaccines, as these brands of vaccines are the only ones with emergency use authorization here in the Philippines for these age bracket. Charles?
Greg, will the alert level system in Metro Manila be downgraded this weekend according to authorities? And just refresh our memory, what conditions must be met so this can happen?
Charles, according to Vergere, they can't say just yet if the alert level systems over the national capital region be de-escalated to alert level 3 by weekend, because Vergere said there will be a series of meetings with other members of the IATF starting today. But aside from the declining number of cases, Vergere said authorities would have to consider all other factors or all other indications for the possibility of de-escalating the alert level system. This could be the utilization of the hospital beds and ICU beds, and for the shortened period for the detection and isolation of an individual or of a positive individual, among others. Charles?
Yeah, we're noticing that restrictions are loosening across the board, Greg. Let's talk about the pilot run of face-to-face classes. Do we have any updates on this?
Charles, according to Vergere, since the children that will be part of the pilot run of the face-to-face classes aren't part of the vaccine rollout, Vergere said that what has been agreed upon by child experts, including DOH and the Department of Education, those individuals or teachers and non-teaching professionals or personnel in these areas where the pilot run of face-to-face classes will happen, they will be the ones who have to be vaccinated, not the children, because as the Department of Health has explained, there are still no recommendation for the vaccination of children or of minor without comorbidities, and especially that we don't have EUA yet for any brands that will cover children ages 11 and below. Charles?
Greg, given the current trend, what are the chances of us having a better Christmas this coming December?
Charles, according to Vergere, if we will be able to sustain the continuous decline of the positivity rate, the daily average new cases, and the growth rate and the utilization of hospital beds in the country and in the national capital region and other parts of the country, we may be able to see a better situation come Christmas. But according to Vergere, there is still no room for complacency, as if the number of cases will increase again or the trend will be affected, the authorities might have to maintain or maintain the current restrictions that we are having up until Christmas. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong.